Well, hi, everybody. My name is Greg Olsen, and I'm the Director of the New York State Office for Aging. I want to thank you for joining us today. Really fortunate to have two return guests. This, I think, is the first time that we've invited some folks back, but it couldn't be a more timely conversation. I think we have a lot to talk about today. I wanted to cover this topic because the last time we chatted, which was in the fall, I don't remember necessarily what exact month it is, things were really not good. Not only in New York, but across the country. I mean, New York had made some great strides to stem the tide, and we were in the top 3 in the nation, but we are all really in a bad spot right now. But there is some good news. So let me talk about the good news. Good news is we have a new administration that actually recognizes and speaks about the virus and its devastating impact on the country. We have an administration that is immediately taking action and is developing a plan, including the use of the Defense Production Act. So I think that that's some good news on the horizon. Since we spoke last, we have 2 vaccines. New York is getting its share. There's been a little over 30 million doses that have gone out nationwide. Not as many that have been stuck in the arm, but that's getting ramped up very quickly. New York gets about 300,000 doses. And we're in several phases. We'll talk a little bit about that. So that's the good news. But the other good news is that there's hope. Hope for the first time in a long time that there's light at the end of the tunnel, that we're going to get ourselves out of this, that we're going to get back to some sense of normalcy after going through this now for a year. So that's the good news. What's the bad news? We just hit over 400,000 people that have died nationwide. We have a crisis nationwide in some of the states like California that are where we were back in March, and it doesn't seem to be waning. We have a new strand of virus which spreads much, much quicker than the other one. We are still months away from getting and beating this, getting to the end of it. CDC and Dr. Fauci expect that to be sometime in the fall of 2021. So we still have a ways to go. Individual behaviors, the bad news is individual behaviors are spreading this. We've known about the protocols and the things that we need to do for a year now, and they're still not being done. Hopefully, again, new leadership at the federal level and our continuation to try to, do the things that we need to do, social distancing, mask wearing, which is about as easy as it gets, good hand hygiene. We got to continue to do that. And finally, the bad news is that the needs, especially for the population that we serve, are not going to go away anytime soon, and are not waning. So I couldn't be more pleased to have Kathy Otte, who's the regional administrator for Region 2, the Administration for Community Living, with us, and Becky Preve, who's the executive director of the Association on Aging in New York State. And before I turn it over to the two of you, I just want to say, at least from New York's response, Kathleen, you work for the federal government, but you're responsible for our state and a couple of other states in your portfolio. And of course, Becky and I both cover New York State. But the partnership that I have had personally with both of you guys going through the last year, I don't think that we could have had the success within the Aging Network without the two of you. Some of the policy decisions that, Kathleen, you helped push up the ladder to have decisions made so that we could do the things that we needed to do. Becky and her network and her leadership and being able to adjust on a dime to provide the services and supports that we needed to provide and not have bureaucracy, state or federal, get in the way to allow our network to do what it does best. And that's provide services based on what they see local need is. So Kathleen, Becky, welcome. And Kathleen, just briefly remind folks what it is that ACL does and what it is that you do.
Very good. Thank you. It's just a pleasure to be here. I'm glad to be your first repeat guest. So thank you for that, and for your viewers for attending. Well, I represent the Assistant Secretary on Aging, representing Region 2, which is New York, New Jersey, Puerto Rico, and Virgin Islands. Kind of a small region, if you will, but what we do in this is really quite important because we have the population of both New York and New Jersey is substantial. The territories, they too have a really big role to play, and they've taken an active role, of course, in this pandemic response. But my role is basically to help with the administration of the Older Americans Act funds, make sure that they go to the right place, doing the right thing. But it's much more than that. It's about sending out initiatives and making sure that our Older Americans Act programming really help people remain in their communities and have choice, where they want to live, who they want to live with. So I'm honored to represent Region 2 as the regional administrator. And I think I've been in this role for almost 10 years now, which is a little hard to believe, but I think it's true.
Yeah, and you know where I stand because you used to be the New Hampshire State Unit on Aging Director. And, I think what you said about your role is really important. I just want to underscore this, how important it was for you to hear us, and you've always been that way with us. So that was nothing new. What's going on in your state, the things that we were seeing, that Becky was floating up to me, that the AAAs were floating up to us, the things that we saw as we were trying to, maneuver our way earlier on, and how important a role you played in raising those before the rest of the nation was even dealing with any of this, to get policy, program, and other decisions made quickly, and oftentimes in writing, which isn't always easy to do. And so I just want to, again, thank you for all your effort, for as long as I've ever known you, but this last year has been tremendous. Becky, remind folks again, what it is you do in your position, but what the network that you represent does and how they do it.
Sure. And first and foremost, I want to thank both of you. I think New York is really a standout for many reasons. Greg, your leadership at the state, and Kathleen, your leadership, prior to COVID and absolutely through COVID. So thank you both. Our network really is an amazing, diverse group of individuals. So the way New York State is structured, we have 59 area agencies on aging. Many of you know them as offices for the aging. The term is used interchangeably. And those 59, which are mostly county-based, contract with about 1,200 independent subcontractors throughout New York State. So really serving a very large group of individuals and a very large group of providers. And, we've talked previously on these interviews about what the network does. Today I really just want to focus on the fact we've been around for 40 plus years. We're trusted in the community, and especially during times of crisis, we are standing ready, willing, and able to assist families, caregivers, really through a variety of different programs and services. So, really the takeaway is that an Office for the Aging or a AAA doesn't just do a meal program. We do just about everything. And if you're watching today and you're having an issue with a family, friend, caregiver, absolutely reach out to our network through our New York Connect system. I believe Kelly's going to post those links because really we're a diverse group of individuals that can serve pretty much any need that may arise. And, as you spoke to, Greg, through the COVID pandemic, we've seen this network change almost overnight on their service delivery and their scope of practice, and they did so without as much of a hiccup. So really proud of our network, really proud to work with our partnerships. And I encourage people that are having difficulties to really reach out to your local office.
Yeah, thanks, Becky. And that's why I thought that the timing for this was so important, because we are still a ways away. There still are needs out there. Some folks that may not have needed service 4 months ago may find themselves in a different situation. So not that this is a repeat of what we did. I think we're going to delve into a couple new things that have come up, but certainly I never think you can say it enough that it doesn't matter the 20 to 30 services that are offered in every community across the state. The message is never to remember all of those services. What is the takeaway is there's one office you can start with to help you navigate those things that you may not even know you need or are eligible for, or are calling to make sure that you get addressed quickly. So, as we watched over the summer and the fall, discussions about the next stimulus bill, et cetera, that just dragged on and on and on. And people were very frustrated with Congress because they weren't stepping up to support, families across America. But, for us here, as being one of the first states where COVID really hit us was in March. It was April where ACL got like an unprecedented, almost $1 trillion of additional funds. So that happened very, very quickly. And then, of course, in the last stimulus that just passed a couple of weeks ago, there was additional supplemental funds. So, Kathleen, for those who are out there who are service providers or AAAs, there is some additional relief on the way. Can you talk a little bit about what these funds are for? We call those earmarks, but it's basically like there's direction in how these funds should be spent.
Yeah, you're right, though, Greg. There is some good news, and it is hard to believe we've been at this almost a year. I mean, March will mark that year point, but I'm encouraged because we did receive some COVID funding in December of last year, and it was substantial funding, and it was made and provided so that it would complement the CARES Act funding, which we received last April. So we received at ACL 2 distinct grants, and again, they're substantial. One covers our senior nutrition programming. That was a sizable grant, $175 million. $7 million of that to go to our tribal partners, because again, they too are utilizing these funds to help keep people at home. It's the human services piece of this, the nutrition and the home and supports, all of those things that constitute how we keep people safe in their environments during a pandemic. So this additional $175 million really will help extend some of the programming that we started as a result of COVID, and also help some of our states and our local governments with the additional number of people that they're serving, because again, we hate to see wait lists when people still have needs. So this additional funding, as it relates to the coronavirus extension, is really going to be very helpful. People are asking, when are these dollars going to become available? I would tell you it's going to take 4 to 6 weeks. We're waiting on a spending plan. In the federal government, the dollars are appropriated. They go to the Office of Budget and Management. There's an apportionment and a spending plan, and that's what we're waiting for. But not to pat ourselves on the back, but I think we turned the money pretty quickly. As soon as it came into ACL, we worked the formula grant distribution, which these grants will be a part of. Every state will has a formula, and these dollars will be appropriated as per the formula for each state. And we'll get that money out. So that's one piece of it. The second piece, of course, is also very important, and I would even say as much exciting. We received $100 million to really do something we've never done before on a national basis, and that is serve adult protective services. We certainly fund adult protective services in different ways in states. Sometimes it's through a block grant, a social service block grant. Sometimes it's through the Older Americans Act monies. But long story short, it's always been challenging because we really have never had a national funding source. This time we do, specifically related to support adult protective services during COVID. The bill states that not less than $50 million should go to state adult protective services areas. Sometimes that's within the state unit on aging, sometimes it is not. But what I want to remind folks that are listening to this is adult protective services actually protect older adults and people with disabilities from abuse, neglect, exploitation, and also self-neglect, which is something our adult protective service workers are seeing more and more because people are socially isolating. So again, ACL received $100 million. We are working on the spending. We haven't received the spending plan, but we'll be disseminating that through the formula grants very shortly. And I'm excited to say that because, again, we know that there's a lot of fraud out there that's accompanied much of this COVID response. But also our APS workers are in need of PPE and tablets to do their work. There's some really fundamental needs that we know that this appropriation will help. So that's just the summary of some funds that are yet to come, but are scheduled to arrive to our providers, we're saying in 4 to 6 weeks in very important areas.
Yeah, I think the elder justice funding, at least from my perspective, was a real welcome surprise. But as we've been talking about, the impact and the predictable impact of social isolation in terms of financial abuse, elder abuse, self-neglect, not only with the older population, but really across the population spectrum with all the triggers, the homeschooling, the not sure if you have a job, the loss of job, the loss of health care, knowing you have to go to work and potentially you're bringing people home. There's so many stressors and anxiety ridden areas. So to see, that in there, I think was great. So everybody knows about the CARES Act, right? Because it was talked about, and holy cow, was that beneficial to New York State. I know it was to other states, but I know what it meant to us. I know what it meant to Becky's network. We'll talk a little bit about nutrition in a minute, but how does this funding differ from the CARES Act funding?
Well, I think again, there's the two sections, nutrition. It'll help extend what we've already started, which, as you know, and certainly your listeners know, we've served almost 75% more people, during the pandemic than we were previously. So it's really to keep and alleviate wait lists. I think, again, advocacy has played a huge role in this. We know that people on the Hill, our legislators, our congressional staff, they really have been listening to advocates about this. They're listening to needs. So, for example, the Elder Justice Council, the folks on the Hill asked for some of the notes to those meetings so that they could look and see what was being reported across the United States for elder abuse and neglect and exploitation victims, and also APS employees. What are the needs? So I think advocacy has played a huge role in this, but much more kind of the nuts and bolts of it is to extend what we started last year, recognizing that there's certainly a health response, but there's also a human service response, that we need to be able to fund that, and our Congress needs to know what those services are for human services. So that, we talk about it's certainly much more than a meal, and it is, because we're keeping people alive and thriving in their communities. So it's just to extend upon what we're doing currently, but hopefully maybe reaching people and keeping them healthy and served a little longer.
Yeah, no, that's great. And one more thing, and that I'd just like to have you address before I shift it back over to Becky is, the Older Americans Act, and fortunately in New York State statute, we have a lot of flexibility, always have, and not unlimited, but a lot of flexibility. I mean, the way that this network is designed, and with the area plans and the identification of need and the public hearings and all the other things that go into that, this is locally driven. We're all partnerships and there's different levels, but this really is a grassroots oriented and structured network. One of the probably the two most important things for New York was the Federal Disaster Declaration, which really provided a lot of flexibility, even more flexibility within the Older Americans Act programs. And of course, Governor Cuomo's executive orders that we were a part of that gave us that similar type of flexibility. Can you speak a little bit to, was the flexibility maintenance maintained within this latest round?
Yes, it was. And I think that's the other good piece of this. They basically extended all of the flexibilities that were in the CARES Act so that State Unit on Aging had some flexibility about spending categories. As you know, there's some requirements that you can only spend or transfer so much per line item. And again, trying to speak very generally, this particular act or funding just complements the CARES Act, where we had those flexibilities built in. And I just can't help but stop and say that I'm so proud of New York, because truly New York has led the way in a lot of these areas, recognizing our home delivered meal personnel as first responders, that they were there on the front scene. Many of the states did that, but they did it later. And I think, again, right out of the chute, we were able to really respond to those needs. And also, we suffered some of the first casualties. Some of our volunteers passed away from home delivered meal delivery in contracting the virus. So again, right on the very edge of being very innovative, but also meeting a need in a very expeditious manner. And New York's to be congratulated.
Well, thank you. This is going to be weird, Becky, because you said we're more than just a meal, and now I'm going to ask you a nutrition at meal question. But again, talk about again, we see the investments in nutrition in several of the stimulus bills. We've also seen an investment in other services that were clearly needed. But let's focus in a little bit on nutrition, because I think when you look at not only our network, but then all of New York State government with the Nourish New York initiative and all the work that the Department of Agricultural Markets and the Health Department, and so many others, and the Food Bank Network. So there's a lot of pieces to it. It's not just us, but what happened within our network was really unprecedented. Talk a little bit about what your members and you personally saw and are still continuing to see.
Sure. So what we really saw is, prior to COVID, we actually had the largest nutrition program in the country. So we were very robust. And what happened with COVID, when New York was hit as hard as it was, as I spoke to, we literally had to shut down the 800 senior centers that produced meals every day and transition to a home delivered meal model. On top of that, we had a large segment of the population who may have been eligible for meals based on age or chronic health conditions, that were still able to go out into their communities with, a lower level of support. When we saw, the stay-at-home order and really the rate of infection in older people and what those health outcomes were, the network really became responsible for everybody over the age of 60 when it came to food or food insecurities. And so we saw a massive increase in our home delivered meal program. And again, what our network does is we never want to say no. And if someone is calling because they're hungry and they can't get to a store or get to food, we weren't going to let them not get service. So those individuals were onboarded early on in COVID. And the thought process initially was these people would be able to transition off as we got the infection under control or a vaccine. We're now a year later. The network as a whole is not seeing a decrease in those numbers. And there's a couple of reasons. Number one, we're still going through the pandemic. But the second part is a lot of people that may have been hesitant to reach out for our programs or services and thought they weren't necessary when they realized the quality of the meals that we produce, the fact that there's a health and safety check. It's a way to streamline information to homebound individuals. And it's a guaranteed way to combat food insecurity. These people are staying on the program, which is, very well intended. We're happy to serve them. The issue that we're running to, through collectively is that the stimulus funding has been imperative for us to be able to continue services. But the question now becomes, now that we have this caseload, which has increased, 70 to 90% as far as our numbers, if there's not an additional investment, we're not going to be able to continue under the flat funding that we typically receive to be able to provide that service. And I think, COVID highlighted the importance of food insecurity, whether it be for younger people or older people. And it's really shown a spotlight on not only our network, but other food networks and how important and vital food is for people's health and well-being. And, moving forward, what we're really looking at is taking this as an opportunity to change the lens under the Older Americans Act, how we do our book of business, the fact that there's been numerous chapter amendments without additional investments, that we've really absorbed all of those issues on an ongoing basis without,
I don't mean to cut you off. Let me hold you there because I actually have a question about the Older Americans Act and you're kind of jumping the gun, but I want to come back in a second because what you mentioned was something really important, right? We have the largest nutrition program in the country, and that takes on 4 different pieces to it. And you talked about, the huge increase in home delivered meals, which, based on the data that I've seen in New York is between 6 and 7 million additional, meals, which is hugely significant. But you made a couple of other points that were really important that I just want you to comment on. It wasn't just home delivered meals. There were people under, the Matilda's Law guidance who, could make their own food, but didn't want to go to the grocery store because they're at risk. And so the network stepped in to provide groceries and supplies. They were able to revamp how their senior centers, we call them congregate sites because it's senior centers and other places, where you could drive through and pick up some food or working with the food banks, et cetera. So it was more than just the home delivered meal. There was this huge universe about it, but your other points I think are critically important. Provides an opportunity to help people who may not be aware they're eligible for SNAP to put, $2,000 to $3,000 more dollars in their pocket. The HEAP program under Medicare, low income subsidy, and the Medicare savings program. So in an really bad time economically, it provides all those other things that the Aging Network does that I think often don't get linked together, that the person-to-person contact, whether it be through a door or traditionally, allows those other types of things to happen. Can you comment on that? Because you used to do this personally in your past job.
So, I think you raised some really great points. And just to kind of tie into more of the nutrition end of things, we saw collectively across the state, mass food distribution, food boxes were delivered, the grab and go sites, to really support people that actually could prepare food. The second piece of what the home delivered meal program really does, and I'll use, my previous example, we used to do a direct mailing a couple times a year to say, do you know if you make X amount of dollars, we may be able to get your Part B premium back for you, which is that MSP program you spoke to. And people who may have seen it in the newspaper or heard about it on the radio never connected it. But when they saw it in their home delivered meal package, a little pamphlet, they would reach out and we could get them enrolled in services. The other thing that the network does, especially through our delivery program, is our volunteers or whoever is delivering that meal, they know that client. And even if it's a contactless delivery, if they look through the window and Mrs. Smith didn't get dressed today, or she looks like she's a bit pale, or the dishes are piled up in the sink and she normally doesn't operate that way, we make those follow-up contacts and calls. And I can tell you, through our home delivered meal program, every day people are found either may have wandered outside and fallen and not been able to get up, or had a medical event, had a stroke and were not able to talk. We don't just leave the meal and walk away and not check on that individual. The other way that the network works is anybody that's receiving that meal, they're in contact with their local office for the aging, which might turn into, can we get this individual personal emergency response system so they don't have to call 911 on a phone? Can we network with the family to provide additional assistance? So it's really a wraparound service, not just that meal. And I think that that's why there's such value in providing that meal, and why it's so important that we're able to continue to service these individuals, hopefully this year when we're going to get max vaccines and be able to go somewhat back to normal. And on top of that, we have the fourth largest population over the age of 60 in the country. So, New York State really sits in a place where we have a very large volume to serve and want to continue doing so.
Yeah, no, and I appreciate that. So thank you for getting into that detail. And that's why, again, we wanted to do this today. There's a myth about what the Aging Network does going back a long way, trips and bingo. Yeah, no, that's not what it is. And I think, both Kathleen and Becky expressed it, very clearly, all the nuances and things that can really help people maintain their health, their independence, and get their needs met. So I believe Kelly, if she has it, I'm going to ask her now, to put in the information on how people can get assistance. That's going to be through our New York Connects 1-800 number that can route you to your county, or you have every single county in New York State has an office for the aging, an area agency on aging. It could be a different name, but they're usually considered offices for the aging. It's the place to go to start for yourself, your spouse, somebody you're caring for, a grandparent, a sister, a brother. Start there. If they can't provide the service, they can link you. They're not going to say it's not my job. So probably the biggest issue that everybody is waiting for us to talk about is vaccines. So obviously, that is a huge concern. That's the good news. But we have to temper the good news with some reality. So we are now in New York State in what's called phase 1B. Phase 1A, folks will remember, is to get all the healthcare workers and the nursing home residents vaccinated. And in many places that's been completed and they're moving into 1B. Maybe in areas in downstate, they're still working on 1A. 1B, though, is a little bit broader of a group, right? It started out with the 75 plus. When the CDC recommended a week ago, the 65 plus, that was added. And also those are teachers and first responders. So New York State, you're talking about 7 million people in phase 1B. The governor has been explicit every single day to talk about, look, we have to make sure that we have the infrastructure in place. It's a daunting task, but they are working around the clock to bring on 7,000 additional providers and administration sites. They're developing and implementing and have already opened vaccination sites across the state. That will continue, but you have to temper the reality that we are scheduled to get 300,000 doses a week, and we've got a pot of people with 7 million. Then the governor announced a couple of days ago that we're actually not getting our full 300,000 allotment. So I'm hopeful with the change in administration at the federal level, the implementation of the Defense Production Act, and potentially other pharmaceutical companies getting through their review process, there will be a huge surge in vaccinations. But, Becky, for your members and your network, there's got to be some logistical pressure points here, right? So you have people who are going to not have the ability to get onto technology, where making these appointments are technology-based primarily. You're going to have people that might, for a variety of reasons, not be able to get to a particular vaccination site because, a visual impairment, or they might be in a wheelchair, and, members might have to provide transportation. Then you have a group of people that just won't be able to leave their homes and are going to need people actually going there. So, from your members' perspectives, because I know it's organized a little bit differently in every county, how are your members, the AAAs, being utilized in the vaccination rollout effort, and equally as important, addressing the needed outreach that we should be taking it? It's effective, it's safe, while tempering the expectation that, hey, it's going to take a few months for us to get through all of this. You're not going to be able to get it today, but you're in line.
So I'm going to start with kind of just reiterating something that you raised, because, since this was announced, every day I'm inundated with phone calls or emails, questions, concerns, that we just don't have enough vaccines to get people mass vaccinated overnight. And so we're really trying to make sure we're reassuring anyone that's calling or we're working with, to tell them this is a process. We don't have enough vaccines at this time. And really the items that you spoke about, they're a work in progress that are changing every couple of hours. So collectively, the network has really taken the stance of, predominantly they reside in local county government, and they have a great partnership with their departments of public health. Obviously, this is a public health emergency. And so depending on the area that you're in or the capacity, so again, pharmacies that are vaccinating the 65 plus, what they have available in Suffolk County is going to look very different from what we have here in Franklin County. So really trying to be a local resource to be able to tell individuals, if this pharmacy does have capacity. We're doing a lot on education for people that do have access to technology or have adult children that can help with those. We do steer everyone to the Department of Health website to, am I eligible, if they're able to be on technology, as well as the 1-800 number. For those individuals that you spoke about, the really vulnerable population that aren't going to be able to do that, many counties are actually having staff do the enrollment online for them, which again, it's a little bit different based on the area of the state you're in and the capacity of that AAA and the number of vaccines available. But we're also able to really take a look from our data system at our customers who are over the age of 65. And so we can do direct outreach to those individuals to say you are eligible for the vaccine. So we're really trying to be as nimble as possible. We are also working on transportation for people that may not have vehicles or access to public transportation, but could get to a pharmacy or a site. And then also looking to troubleshoot those truly homebound individuals that we can't get to a site. How are we going to get the vaccine to them? So, our hope is we're going to have more definitive answers as we walk through this process. But I think really the messaging is that we need to be patient. We need to make sure that we're telling people we will get them the vaccine, but it's going to be a process and take some time. And if you're struggling at your local level and you can't have access to that Department of Health website or the 1-800 number, to reach out locally to see what resources are available for you or your family.
Yeah, thanks. And I think Kelly, if hasn't already, will put the state's link in to get appointments made for your vaccine, as well as the 800 number. And again, to reiterate, look, we all want the vaccine. We're all so excited to get out of this mode that we're in. But until supply increases, we can only do what we can do. So for folks out there, try to get your appointment as quickly as you can by getting onto those resources and getting them scheduled. But it is going to take several weeks, several months before we get through this phase and then can start to get to other less risky populations. I mean, we're all at risk, but obviously, the population that we serve is a priority. So I'm going to shift gears a little bit. Kathleen, you've lived and I'm going to say this in the most positive way. You've lived under the Older Americans Act, and you've lived under Older Americans Month. I find them to be both very exciting, but implementing Older Americans Month to me is much more exciting. I mean, obviously, what we do here in New York State. I want to talk a little bit about, the theme selection. Certainly for 2020, we had to postpone ours, obviously, because we do a really big gathering to honor people from every county, not only individually, but representing, the million volunteers that we have and all the various agencies that they work for and groups. It's not one particular volunteer experience. It's just amazing. But the theme was make your mark. Give me a little retrospective view from your perspective on what you think about that now that we're in the pandemic. And then I want to ask you about the 2021 Older Americans Month.
Well, thank you. Yes, as you well know, the Older Americans Month theme is usually announced in February. And indeed, that's what happened last year in 2020. Make Your Mark was announced. February is rolling along. Everybody's gearing up. New York does an exceptional job of really celebrating older Americans that live in New York and, highlighting stories and make sure people are recognized. I mean, you just do a phenomenal job. But Make Your Mark took on a much more significant role, I think, last year, because really our older adults were served and saved by older adults. Truly, I mean, the volunteers that are older that are providing the meal deliveries and helping out with making telephone calls, older Americans really rose to the occasion. And isn't that something? Because they really were the ones that were exposed, as you say, statistically most vulnerable to this pandemic. They made their mark by being brave, but also being very smart, because they wore protective clothing. They wore the masks immediately. And again, we had Matilda's Law in New York to kind of help support that, making sure that older adults actually could go to a safer volunteer effort so that they weren't so totally exposed. But Make Your Mark, as I look back, it was poignant. It was, we are making our way. The older adults of today don't look, feel, act, or really exhibit the same characteristics that they did 20 and 30 years ago. And so Make Your Mark, in my mind, for Older Americans Month, that theme was really poignant because, again, they made their mark in a totally different way that we hope they never have to do again. But it was really substantial. And I think at the end of the day, we had to cancel a lot of festivities, but we just kept on churning. And at the end of the day, we could celebrate that everybody really was productive and really lived the theme.
Yeah, and you're right. And so the theme of 2021 is communities of strength. And so I want you to comment on that. And then I'm going to give you my 2 cents and hopefully transition beautifully into the Older Americans Act question.
Oh, perfect. So yes, indeed, communities of strength. I mean, that says it all. But what we know is communities can be whatever you choose it to be. For example, nursing facilities. People make their home in nursing facilities. They consider the staff and the people that visit their community. And what I love about this year's theme is we're recognizing communities of all areas, nursing facilities, people who remain in home, the communities that you live in and you've suffered through this time with. Communities of strength is really capturing the total experience of what it's like to go through a pandemic, what it's like to be able to rely upon friends and neighbors to help you and to support you. Communities of strength means to me that human services piece of why it's important to be human, why it's important to recognize the services that complement healthcare responses, but are so vital to our existence and certainly support of older Americans. So communities of strength is this year's theme. It came out a little earlier than we normally do. It came out in November, December, so people could begin to think about it. But truly, throughout the United States, during the month of May, we're really going to be celebrating the communities that have shown the strength and the perseverance to help people get through this time. And if you love older adults, like many of us that are listening to this broadcast and those of us that work in these services, it's usually because you had somebody that mentored you as an older person. They may not have known that they were doing it, but they did. So my grandmother was that person to me. I remember her making home delivered meals before we had home delivered meals. That's how old I am, before the Older Americans Act was actually in effect. And I mean, it passed in 65, but about 5 years later was when the meals began to be delivered. And I say that because communities of strength could be anything. It needs to be what it is most important to individuals and to celebrate that as we go forward.
Yeah, thanks, Kathleen. I tell you the 2 things, and then I think this is going to be relevant to why we brought this up now, why would we talk about Older Americans Month? Well, the Make Your Mark and the communities of strength are the 2 things that we absolutely saw in New York. And New York can be looked at one community, the entire state, or right down to the most local level, the smallest town. That's what we did see. we know that we wouldn't have a service network in New York State for us without our volunteers. We know that many of the employees that we employ are older, and we know nationwide that older adults support 90 million jobs. So, you know, people who are older aren't sitting home doing nothing. They're workers, they're working, and they're volunteering. And you know how much I love numbers. We have 1 million volunteers in New York over the age of 55, putting in 495 million hours of service every year at an economic value of 13.8 billion. Then to see the way the communities came together, because, you know, we did lose capacity. We lost volunteers, we lost workers from COVID, but also because they were afraid. You know, we had Matilda's Law. But we had a lot of people that said, I'm still going to continue to do what I do. And thank God for them. But we had, you know, teachers and Boy Scouts and a whole new crop of volunteers. We had college students. That's the community's strength. Communities always seem to step up in time of need. And I think the two really matter. But Becky, I'm going to get to, you know, and I know we don't have a ton of time left, but this issue is important because volunteers are always going to be important, not only to our network, but to our overall wellness, our sense of community, our mental health, our physical strength, our being connected, lack of isolation, reduces depression, all of those things. So I think there's always room in the work that we do to cultivate and expand volunteerism. But I think we are at a really unique opportunity in time to really take a look at the Older Americans Act, because our network was structured to rely almost exclusively on volunteers, whether it be the long-term care ombudsman program, our health information insurance counseling program, our nutrition program, and many, many others. So talk to me a little bit about what you're thinking about in terms of this opportunity with a new administration, the majority leader that comes from New York State, an House Appropriations Committee chair that comes from New York State, and what we know about the healthcare system embracing social determinants and paying for the types of things that we do. What are some of the opportunities that we need to be leading the nation on to get the messaging out there that now's the time to move this network into the 21st century?
That's a big question, Greg. But, you know, one with some really low-hanging fruit as far as answers. So, you know, as Kathleen mentioned, the Older Americans Act was constructed in 1965. And yes, there's been amendments to that. But predominantly any amendment that came with a regulatory change didn't come with any additional funding. So that's issue kind of number one. You know, we spoke about the volunteer base. People are working much, much longer, whether that be for economic reasons or personal reasons. So the volunteer base, although we do have a massive amount of volunteers in New York State that we could not operate without, who are just amazing individuals, you know, it's really not appropriate in this day and age with the number of older people, you know, 85 plus, the fastest growing segment of that population. It's really a time where we need to look at having professional paid trained staff doing some of those things. So I'll use, you know, you raised the ombudsman program. The ombudsman program, predominantly run by volunteers, is intensive training. There is a large amount of paperwork that needs to be completed. And in our current healthcare system, very complex issues that are being tackled by these volunteers. And so, you know, I look under the Older Americans Act at the fact that if you look at other health systems, they've gone through massive reform as far as admissions criteria, billing structures, and kind of the umbrella that they're under at a federal level. We need to look at the Older Americans Act in the same way. You raised another point, which I'd like to jump in on, that's not just connected to dollars, because I think a fiscal ask is absolutely necessary based on the capacity increase, but also the fact that we need to rely on the localities that are doing this work to direct where funding goes and how we appropriate it. So, you know, again, I look at New York State, how vast we are, the differences between urban and rural. For us collectively to have one ask for the entire state, you know, really isn't the way to go. We need to have the flexibility of one area to say, this is what our need is, this is how we're going to address it. And really have the continued flexibility that we've seen under the disaster declaration continue as we move forward. So as you mentioned, I think from a federal standpoint, New York State is really in a place where we have shown the value and the quality of the work that we do. We have seen a massive increase and have taken that burden. And we also have leadership now that really has a better understanding of New York, our diversity, and the needs that we have here. So it's something that we're definitely focused on moving forward, as well as the very appropriate fiscal ask for an investment in aging services that is so necessary.
Yeah, thanks. And, I think that there's a lot more details that we can discuss in future areas. So I'm not going to get to the last question because we're running a little short on time. I believe Kelly, who is the master behind the green screen, there are some questions for our guests today.
Yeah, thank you, Greg. Our first question comes from Linda. She says, I am a geriatric care manager working in the Mid-Hudson Valley region. The home health aid shortage has only gotten worse with the pandemic. Is there any hope of better funding for salary increases for home health aides?
So I can tell you that is an issue not only in the area that you represent, but an issue across New York State and across the country. We could do a whole show on this, but you're absolutely right. We have a really strong partnership with Al Cardillo and the Home Care Association, who did an analysis of what the network looks like and the reductions over the pandemic. So it's an issue that's definitely matters to us because we have a fairly large in-home program. I know that it's something that Becky would probably comment on from her perspective in the association.
Yeah, and I would just, thank you for the question. What I can tell you is this is something we've been working on for years. It is crippling to our infrastructure based on the fact we do have a home care program for non-Medicaid eligible individuals. And we work very closely with the health systems as far as even under the Medicaid umbrella. This spans aging and disability. It is a problem no matter where you are. We are very active and continue to be so in the legislature as far as raising this issue, raising awareness. We're also working on a couple public service campaigns with some organizations out of the New York City area that are going to be released this year. So it's something that is absolutely on the radar. We're working very diligently on, and I couldn't agree more that we need to do something about the wages.
Yeah, Greg, if I could just chime in, this is something we see throughout the nation. We have a workforce shortage. We also have a livable wage that we need to talk about. This administration has talked about $15 an hour as a minimum wage. I don't know if that will pass, but again, many states have tried to look at this. They've done some creative things like really paying older adults to take care of older adults, but this is hard work and it's special work. So again, I think the question that's been raised is something that affects all of us. But we hope that with this administration, it'll be tackled because this is something as our population grows older and more people are living longer, we're going to have to address at some point in time.
Thanks for that question. Kelly, another question?
Yep. So Pam, who's watching from Cortland, shares that she has worked for 41 years in the aging field and most recently 17 years at the Office for Aging. Unfortunately, she had to retire to do remote learning with her grandchildren. But she suggests that this could be a workforce to tap into for temporary help through pandemic, which then Mary Lou followed up with, are volunteers needed by the offices for the aging to sign people up for the vaccine? She said she'd be willing to do it from home if possible. So just if people were interested in volunteering to help get people signed up through the portal, to whom should they reach out to or how could they help in that effort?
Well, I will answer that, and I'm sure Becky will agree with me. When we do anything out in the community, when we do these Facebook Lives, whatever we do, we are always pitching folks for their help. So not only was that a great suggestion, but a great follow-up. We're always looking for volunteers, regardless of what the role may be. But the role that you are talking about is very specific. And I would be hard pressed to believe that any Office for the Aging or the infrastructure that they're working in on the vaccination wouldn't take a hand or two to assist people. Because again, there are many people, we talk about Cortland, there's parts of Cortland that are wired and there's parts of Cortland that aren't wired. I know that county very, very well. I'm sitting right outside of Albany, New York, and I can go right up the street and there's no Wi-Fi. And that's going to be a fact across states. And there are going to need people to be able to assist in making those appointments. So I would reach out to your local office for aging, and depending on the structure of how they're rolling out the vaccines in their particular county, I'm sure they could use your help. And for anybody else listening that would want to, provide that telephone support, it's very, very welcome. So thank you for that question. Do we have one more, Kelly?
We do have one more. It is from Teresa, who was wondering if we could speak to the status of people with immunocompromised, who are immunocompromised, that they have a need for the vaccine clearly, and if we have an idea of when they might be coming up in the eligibility list.
So they're in this eligibility list. So it's people over the age of 65, those that you just described, immunocompromised, as well as teachers and first responders like police and EMS and others. So you should be able to, we put the link in there to go on to the health department site to say, am I eligible? And you should get a yes from that based on your condition. That's the priority. We know those who are highest at risk are based on age, chronic conditions, and compromised immune system. So you should be covered in the phase that we're in now, depending on where you live. The city, just because of the population density, are still in phase 1A, but the rest of the state is rolling out the phase 1B. So you should be eligible now. That's a great question. Thank you. So we never have enough time. We'll probably do a part 3 because we're probably going to be doing this for a while, unfortunately. But I can't thank Kathleen and Becky enough for not only your time, your energy and effort, your passion, but all the help that you've provided to me and my staff and to all New Yorkers. I mean, it has really been amazing. I, again, want to thank Kelly Matija, which I usually do at the beginning. She is the Wizard of Oz behind the green screen that makes all of these happen. And so I can't thank her enough. And our next Facebook Live will be in 2 weeks. And it's on the unfortunate topic of elder justice and elder abuse, but it's something we have to tackle. We have to shine the light on. It's far more prevalent than you think. And in times of crisis like this, particularly with isolation, as Kathleen had talked about earlier, with some of the elder justice money coming to the states, that is a community response just like anything else is. So we're going to have some special guests to really talk about what we're doing and what can be done and really what the public can do. We all have a role in that. And I think, again, the theme of next year's or this year's coming up, Older Americans Month, really lends itself to the whole issue of elder abuse, and that's communities of strength. So I want to thank you all again for joining us. I really enjoy doing this. You guys are great guests, and we'll see you in a couple of weeks. Thank you.
Thank you.